My name is Dr. Chaim Goldberg. I'm a comprehensive ophthalmologist. I wanted to compliment CTV W5 for an excellent investigative journal report regarding a problem called corneal neuralgia. Corneal neuralgia is a rare but potentially devastating complication of Lasik, the most commonly performed laser vision correction procedure in North America. Corneal neuralgia can present itself as a hypersensitivity, photosensitivity, might be pain, burning, dryness, and sometimes excruciating pain. We can diagnose it using a very sophisticated but not clinically available microscope called an in vivo confocal microscope, showing us amputated nerve endings with balls at the end of the amputation. Sometimes we see disoriented nerves coming into an area which is underserviced by nerve tissue. Sometimes we see inflammation. In any case, as I mentioned, because it can be excruciating, it's important to diagnose it early, and we know that with early diagnosis, it can be treatable. Important to know is that this particular complication is specific to Lasik. In Lasik, the technique is to create a flap, raise the flap, do the laser procedure and put the flap back. But the cutting of the flap cuts the nerves. I have chosen not to perform Lasik, and I have performed Lasik as well as other procedures as well. In terms of safety, and safety is my main consideration, there are other laser procedures called advanced surface ablation techniques. Among these, there are PRK, EBK, there is Lasik, spelled L-E-S-E-K, and that is my chosen procedure. With Lasik, we, in a very elegant and sophisticated, gentle manner, raise the epithelial cells and then perform the laser procedure. In our practice, we use wavefront guided laser procedure. Safety is my prime consideration, as I mentioned earlier, and therefore I've chosen a technique which is non-cutting. Surface ablation procedures are not associated with corneal neuralgia. Other things that we do in our particular clinic, which are unique to our clinic, are other tests. For instance, we do biomechanical testing of the cornea, genetic testing, in order to weed out those people who shouldn't have laser procedures. At this time, there is no test for corneal neuralgia in order to identify a patient that might develop it. Safety is our first consideration. We invite you to visit us at the Goldberg Center for Vision Correction.